so much for watching the prenatal crash course series. So this is actually the third video of the series. So if you have not watched videos 1 and 2, which talk about pregnancy and prenatal care, as well as labor and delivery, I think it's very, very important that you check those videos out in the series. And then tomorrow, the next series is actually newborn care. So at least this whole big series is a 4-part video production that has everything that you need from pregnancy, labor and delivery, postpartum care, newborn care. And as you know, the video series also has an online part. The online course you can actually sign up on my website, which is mommydidyouknow.com. I know that this series is going to be so beneficial for you, and it's such a blessing for so many already. So to start off today, we're going to talk about postpartum hygiene. So for postpartum hygiene, it's very important to know how to take care of yourself. Self-care is very important because you can't take care of your child if you don't know how to take care of yourself. So that's why I just thought it would be very important for us to just go over a few things to look out for. So first off, whether you're a vaginal delivery or a cesarean birth, you will have contractions after you have a baby. One thing that can really help out with the contractions is peeing. So one very, very important part of your hygiene after you deliver is to try to pee every 2 to 3 hours. A lot of people don't really realize this until it's too late. But if it's been a while since you peed, you'll not only have more contractions, but you'll also have more bleeding. So try to pee every 2 to 3 hours to help you out. Another thing is, when you pee, you must change your pads. You don't want to hold your pads on for too long, because the more time that those pads are sitting with that dried blood, the more likelihood you are of having UTIs and yeast infections and a whole bunch of other stuff that you definitely don't want to have. So make sure that you're peeing every 2 to 3 hours and that you are changing your pads. When you change your pads, try to use that peri bottle as well, or any plastic bottle that has some water just to wash, because you don't want to have that loose dry blood for too long. You know what I'm saying? So make sure that you're peeing, make sure you're changing your pads, and you're washing with that perineal bottle that they give you in the hospital. You can even buy perineal bottles in like CVS and Walgreens, Walmart. They all have them. They have them online as well, and Amazon. If you look in my description, I'll actually have a few mommy must-haves that will really help you out, from everything from those bottles to perineal medication. So you can check them out in my description. You'll see a little bit more about it. Another thing to note is that it's very important for your hygiene actually to walk. So you don't want to stay in the bed too long. You want to definitely walk, help with the circulation. That'll really help you out in the long run. And I just want to talk a little bit about cesarean births too. If you had a cesarean birth, odds are you probably had something called a Foley catheter, which basically is a catheter that was draining your urine because you were not able to walk, obviously, after having a spinal anesthesia. Another thing is, if you had an epidural, you probably had a Foley as well. So every time you have a Foley in, it's actually increased risk of having UTIs, just because every time something is entering into the urethra, of course, it's going to have a more likelihood of having an infection. So you want to definitely make sure that you have good hygiene, just to kind of prevent those chances of UTIs and infections, because once you have a UTI, it is really, really uncomfortable. And then to go off a little bit more about cesarean births, after you have cesarean birth, you'll notice that you're going to have some pain in your incision site. Usually it's a transverse incision, which goes from right to left, or left to right. It's going this way. But sometimes they do have something called the classical, which is when they go up and down. Sometimes that happens if the baby's very premature, or sometimes mom had a classical incision when she was overseas, and then we're just doing another one over here. So you'll notice sometimes they'll have those differences. What you'll see though is that you'll have pain sometimes on one side more than the other side, and that's normal. It'll feel like a burning or stinging feeling, and that's normal as well. What can help with that is, one, just making sure your bladder is empty, so that's why I'm mentioning again, is 2, you can actually have abdominal binders. A support band is very, very important, just because it kind of helps to keep everything nice and secure, and it prevents you from having a lot of pressure and pain every time you're stepping. You definitely want to make sure you're taking care of your incision site, that you're washing it, you're making sure it's clean and dry. After you wash it, you can still take a shower, but as long as you maintain that incision site clean and dry, because that is very important. If you had a vaginal delivery, you'll notice that you had either an episiotomy or a tear, or sometimes you might have one of those people that were lucky enough to have both, in which case midline episiotomies is usually what they do, and episiotomies sometimes do hurt more than tearing naturally, so keep that in mind. However, sometimes they might have to do an episiotomy if, let's say, the baby's big, or let's say you're a little small statured, or they have any concerns, or sometimes moms might actually prefer to have an episiotomy because they want to tear naturally so that they can stitch it up better. So in which case, whatever it is, but just keep in mind, episiotomies might heal quicker. However, they might hurt and be a little bit more uncomfortable than tearing naturally. A tear is usually defined between a first, second, third, and fourth degree. First tear is just like really, really small, nothing really too crazy there. Fourth tear is actually all the way across, so it actually is pretty intense, so keep that in mind if you're dealing with a tear. I actually had a first degree with both tear, with both of my babies, so I know a little bit about how that feels. And even if you are intact, you obviously pushed out a tiny human up through there, through a tiny little hole, so you might have a little pain and discomfort. What can help is the first few times that you pee, sometimes people are a little nervous about the burning and the stinging. So what I sometimes recommend is to take that peri bottle, that plastic bottle, fill it up with some warm water, and it'll actually neutralize the acidity of the urine as it's coming out. So it'll actually help with the burning, and that actually can help also when you are having that first bowel movement. I know a lot of people are really nervous about that first one. They really recommend Colace, which is a stool softener. We usually give it to our patients twice a day after they have a baby, just to kind of help with constipation, especially because sometimes you have iron supplements, and sometimes after you have a baby, there's just a lot going on that you might want that Colace to soften your stool. If you're really uncomfortable with the gas, they might offer you a Dulcolax, which is a suppository, so it goes all the way up there, if you know what I'm saying. So the Colace helps for constipation. The peri bottle you can spray to help you with neutralize the acidity if you're urinating, and it also helps sometimes if you spray it in the back. It sometimes kind of helps to clear things and just kind of loosen the sphincter muscles to allow you to really have that bowel movement. A few other things to look out for as well when you are cleaning is if you are having big blood clots, you definitely want to let your doctor know, let your nurse know. If you're still in the hospital, definitely let your nurse know. She's kind of the liaison between you and the doctor, because you won't be seeing the doctor that often after you have the baby. So it's very important to have some clear communication between you and your healthcare team, of course. So when you're talking about blood clots and you're talking about heavy bleeding, pretty much you look at the pad and you're looking at how much your pad was saturated within 1 hour. If your pad was about 25% saturated or less, I usually say that that's about scant to small. If it's about 25 to 50%, usually okay, it's like small to moderate. And then if it's around 50% to 75%, that's moderate to heavy. And then what you definitely want to look out for is if it's between 75 to 100%, that is heavy bleeding, in which case if you are saturating 75 to 100% of your pad in 1 hour, that is definitely heavy bleeding, and you want to let someone know as soon as possible. Sometimes there can be little pieces of the placenta that still have fragments inside your uterus, so sometimes they might have to take it out. Sometimes they're massaging your uterus and they might notice that you're something that we call boggy, which basically means it's soft, kind of like jello, and we have to massage it to make it nice and firm. They might have to put Pitocin. Pitocin you might get after you deliver, but if you're bleeding a lot, we might have to put Pitocin to help keep your uterus nice, firm, and strong. So there's a lot of things to look in for after you have a baby. Just so many wonderful things, I'm sure, but at least you have a wonderful blessing, which is your baby. A few other things that you would want to call your doctor about. One is fever. So of course, if you have 100.5 or above, you definitely want to call your doctor. Sometimes you might even get little mild grade fever from actually engorgement. A lot of people don't realize that when you're engorged, you actually might have a fever as well. So if you are engorged with a fever, you can try Tylenol, you can try ice packs or warm packs, and I have consultations as well, so that I can always work with you to go over how to control your engorgement, because I know that is not something that most women look after for. You can also drink a lot of water, stay hydrated, because with engorgement, if you're pumping a lot and you're releasing a lot of your milk, you can be dehydrated. I actually was readmitted with dehydration, so I know all about that because I had a really bad overproduction. So if you have fever, you have engorgement, especially if it is accompanied by something that we call mastitis. Mastitis is basically a breast infection. So if you find yourself heading towards the part where, let's say you have a clogged milk duct that is painful, it's hard to the touch, it's really warm, hot, and especially if it has a fever, you might want to call your doctor to make sure that you do not have mastitis, just because they might have to put you on antibiotics and a few other things. Definitely you want to let your doctor know also if you are having any abnormal mood swings that might be heading towards postpartum depression. After you have a baby, your hormone factory was your placenta. So now that it's gone, it's like everything's everywhere. So, but if you are getting to the point where you are in postpartum depression, you definitely want to call your doctor to see about getting a referral to a specialist. Just because the way that you can tell the difference between postpartum blues and postpartum depression is postpartum depression gets in the way of your daily life, meaning you cannot do anything. You can't get out of the bed. Let's say you get out of the bed, you're just consistently having negative thoughts. And especially if you are thinking of hurting yourself or others, whether it be your family member, your new baby, your child, your friends, those are definitely all signs of postpartum depression, and you want to get it checked out as soon as possible. I hope that all of these recommendations were helpful, and in our next lesson we're actually going to talk about newborn care, which is one of the most exciting topics I think that most moms want to hear about, and we're going to talk about everything from diapering to feeding to safe sleep, just a whole bunch of wonderful things, and I know you will very much enjoy it. Look in my description also, because I do have the entire prenatal crash course via ebook as well as an online course through my website, mommydidyouknow.com, and it is completely free to have the online course. The ebook is only $5, so it's a very reasonable price, and it goes over everything, all the information from all of my video series as well as my online content. And I do offer consultations. So all of these are online. You can do them from Skype, Zelle, Zoom, whatever you would like to do. All of the video conferences, I will be more than happy to help you out on. Thank you so much.